figure out, if somebody came in here from another planet and looked at this for a second, what would they conclude? Like, everybody's looking at me. Am I on trial? Am I giving it? What can they tell by looking at you guys all look so somber because everybody's hungry, right? It's 6 o'clock and nobody's at dinner. What do you read, right? Well, if 9 out of 10 kids can do it, but 1 out of 10 can't, that's 10% incidence of problems. What if it's, what if it's 19 out of 20? Well, that's 5%. What is it? So when you say the incidence of social learning problems crossing the diagnostic threshold is a few percent, you realize what you're saying is it's 1 or 2 out of 100 kids. Well, I can find a lot more than that struggle with social pragmatics. So they meet full diagnostic criteria for autism. Again, you get into this debate in conferences. They get into this debate about you meet full criteria, and when we change the criteria, have we mucked it up? Have we taken kids who really have impairment and symptoms who should be served, and now they're not served? But you can make a social pragmatics diagnosis, which is autism without unusual behavior, basically is what it is, and they've created that. But I prefer a bell curve. If 9 out of 10 children can do it, and 1 out of 10 can't, I would argue that's a problem. Because in a classroom, the teacher teaches to the middle of the bell curve. The teacher manages to the middle of the bell curve. On the playground, it's the middle of the bell curve, right? And so if you're in the 1 out of 10, you have a problem. So if you ask me, what's the incidence of autism, and you want to know the incidence of this kind of social learning adversity in the population, not the incidence of who crosses the diagnostic threshold, but the true incidence of this, then I would argue it's at least 10%. Does that make sense? In a bell curve way. We're not talking about a category. The DSM is a category, right? You have autism or you don't. Well, what if you have all the symptoms but one? You ain't getting a diagnosis, right? And yet you're probably almost as impaired as she is, and she has all the symptoms. And what if, I alluded to this earlier, what if the symptoms you have in an algorithmic way? What is an algorithm? An algorithm gives different weightings to things. So if you applied for a job with me to help me on my research, and your writing skills were important, and you had great recommendations, but you had 3 spelling errors in your resume, that's an algorithmic sign. You're out. Does that make sense? It weighs a whole lot more. And the fact of the matter is that when it comes to autism, certain behaviors are much more powerful in indicating impairment and problems over time when they're present, and when they're absent, they're also powerful in indicating better outcome over time. But the DSM doesn't work by algorithm. And so what if you don't have enough symptoms for a diagnosis, but the symptoms you have algorithmically are very predictive of trouble over time, and you have more than enough symptoms, but the symptoms you have, or the behaviors you have, are not as algorithmically as powerful, right? So it's the questions I want parents to ask is not, does my child have autism, but does my child have an impairment in social learning? Does my child have an impairment in how they regulate their emotions or regulate their behavior? Or does my child have an impairment in engaging in certain repetitive behaviors that for some reason create a homeostasis for them, so they do it over and over and over and over and over again? I don't know what the purpose is, but do they have a problem because it irritates everybody else? I mean, my view is that a lot of these behaviors children do that we consider stereotypic have a purpose. We just don't know what the purpose is. And I don't steal away people's purpose unless I have something better to substitute. And so unless they're not hurting themselves, some of these behaviors, I try and get parents to not be as concerned about. Sure, if out in public, a kid runs out in the middle of the street, you got to do something about that. But in the end, most of these behaviors extinguish independently over time, and sometimes you can use some of these behaviors to your advantage. So I had a boy, I don't have my briefcase here, but I carry it around. I had a boy who liked a spoon, and he had a spoon with a hole in it. And I've had kids who do all kinds of repetitive things, and if they're functional enough, I try and get them to teach me how to do it. You know, it's not quite Sunrise, if you know that, the Sunrise program, but I try and get them to teach me You know, and I never can do it the way they do it. It's never quite right. And now they're teaching me their idiosyncrasy, which is kind of an interesting phenomenon. The string boy was my favorite, because I worked on how to spin the string around to match what he said was the way you have to do it to make yourself feel good. And I couldn't get an orgasm. I mean, I could not do it well enough to, you know, it says you got to flip it, you got to turn it. And anyway, but I with the spoon boy, as he matured in certain kinds of behaviors, we use the spoon as a reinforcer. It's called Premack principle. I used a behavior that he was more interested in engaging in to get him to engage in a behavior that was of less interest and use the behavior he liked. And he would do certain things in order to get the spoon. And the reason I have the spoon is because when he turned 9, he brought me the spoon in a package and said, "I don't need it anymore, here is the deal." And I think in terms of empowering someone, that's a much more empowering way of helping him manage his idiosyncratic behavior. It doesn't always work, but we're impatient. And I think, you know, you have to take I use the word helicopter. You have to realize it's a long way, and your mindset has to be the equivalent of teaching a poorly coordinated child to ride a bicycle. It's going to take a long time, and if you're not patient, if you set arbitrary limits, then you end up with failure. Okay, so this was kind of my whole talk was my introduction. And what a neuropsychologist does, how it's different, and how I approach autism by looking at ability, knowledge, social, academic, emotional knowledge. Abilities, I look at 4 or 5 very specific abilities. And children with autism, in our research and in research of others, you know the one ability, I'll tell you 4 abilities, you tell me which one you think they have problems with. Planning, how you strategize, self-monitor, and organize. Simultaneous, how well you integrate information to solve problems, like what's gray and has 4 legs. Sequencing, how well you work with information in sequence. And attention to detail. Not attention to detail. Not paying attention, but knowing what's important to pay attention to when. Okay? And don't be afraid to make a mistake. How many think it's planning? How many think it's simultaneous? How many think it's simultaneous? It's the autism problem. How many think it's sequencing? How many think it's attention to detail? Oh, you're also smart. It is. It's very interesting. They don't know what to pay attention to when. You show them pictures of social situations, and they look at irrelevant details. Even when they're even when they're intellectually strong, they don't know what to look at. You show them pictures of art. The artist always wants your eye to go to a certain place, and they put. A colleague of mine put a stethoscope so he could see where they were looking, and they don't look where they're supposed to. So they don't really appreciate Renoir or Rembrandt, because they don't look where they're supposed to. You know, for them art is kind of a random experience. They look in other places, and in social situations they have the same problem. You know, we have one of our tasks that we're developing. They see pictures of social situations, and in one situation, there's 2 boys. I was just looking at it, and there's a fence, and it's clear that one boy has kicked his ball, and the ball's about to go over the fence, right? And the question is, what's important? What should what's important right now, and what's happening? And this boy looked in the corner of the picture and said, what was it? There was something that we put down. Oh, look over there. There's a football. I mean, he completely missed the whole, and I think when we try and teach social skills, we're too quick to teach the social skill and not patient enough to appreciate whether someone has the ability to use the social skill, put it within that context. Okay, so that's my introduction. Now, most parents come with, and what's the takeaway message? When you look at your child, think about ability, knowledge, and skill. When you talk to people about your child, don't talk about labels. The label is helpful. The explicit label is helpful because the implicit label that other people form sometimes is crazy. Meaning, if I tell you, she has autism, and we have an agreement on what autism is, you have an understanding. Whereas if I don't tell you and you watch her, you say, boy, she's weird. What is wrong with her? Okay, so sometimes the label is valuable, but for the most part, the label, we talk in functional ways and in functional behavior. So, I would think about, so where are my child's strengths? And are there things I can do to improve his ability in terms of social? For me, it's social. It's all about social. And how am I going to enhance his skill? I'll give you an example. One of our research projects a long time ago that I regret I never got around to publishing. We looked at what predicts better adjustment in kids with autism, different diagnoses, was more stringent. What predicts better adjustment as an adolescent and late latency. These kids are 9, 10, 11. And we found kids who read for pleasure, who weren't aggressive in the face of conflict, meaning they didn't respond aggressively, and had a single friend. Now, I grew up in a gigantic apartment building. There were 450 families in the one building in New York City, and there were 7 buildings. I mean, this was big time, right? And now I remember, as I've learned about autism, thinking back, there were so many kids. But even the kids with autism could find other kids with autism to interact with. Everybody had friends, and that's not always possible when you live in the suburbs, right? So having a single friend. So I tell that to parents. So your child's 10 or 11, does he read for pleasure? No. And I've had a parent ask me, well, what if he plays video games for pleasure? I don't know. I don't have any research on that. Does he get really angry and aggressive in the face of stress? No. Okay, that's a good prognostic indicator. What if he does? Well, we got to try and do something about that. We start with psychosocial interventions, and if that doesn't work, we go see Carmela and see if there's a medicine. We're not treating the autism, we're treating his problems with emotional regulation. See if there's a medicine that might help. Does he have a single friend? No. Well, then we've got to find him a friend, even if his friend is as strange as he is. We have to find him a friend, no matter how we do it, because there's something about having that reciprocal interaction over a period of time that maybe plays some role in our development and our mindset, maybe nurtures our souls, whatever the case may be. It seems to be a variable that makes a difference. We had a project, Elaine Pollock and I, Elaine is now at primary, and we had a 16-week social skills program, this was 25 years ago, to try and teach latency aid kids socialization. And they'd come every week for 2 hours. And we had this curriculum trying to teach them theory of mind, right? Taking perspective, which they have a hard time with. And remember, not everybody with theory of mind has autism. With theory of mind problems has autism, because all 2-year-olds don't have theory of mind. They don't have autism, right? So, but we were going to try and teach them to take perspective of others, and we had this curriculum that we were developing, and we thought, we're going to solve this problem, and everybody will teach these kids how to do this. And the kids would come in, and they'd learn the stuff, and they'd practice it. I would come in and tell a joke, and they wouldn't laugh, right? And then one of them would tell a joke, and they would all laugh. And there were just certain key words that they would use in their humor that wasn't a part of my vernacular, and they all thought that was funny. Again, that sort of attention to irrelevant detail. I tell a funny joke, they don't think it's funny. And they use certain potty words, and they think that's hilarious. It's like, why do you think that's, well, I can't explain it, but it is. We failed miserably. The kids had a great time. At the end, they were not any more functional. The dependent measure was what they were doing in school, and they were no more functional. And yet, there was a great success, because the parents, this is when I was on 39 South, the parents sat in the waiting room, and the kids made friends. For the first time, this is 25 years ago, these guys weren't even born yet, and there were no programs in the schools, and there was nothing for autism, and people just looked at you like, oh, autism, right? Those kids are at the state hospital down in Provo, right? Or at the training school down in the American Fork. But the kids for the first time had a friend, and they exchanged phone numbers. And they had play dates. And the parents were willing to drive, because for the first time, my kid has a friend, right? And I would have parents years later would still come and tell me that that was the best thing that ever happened. And they didn't pay for the social skills program because it was research we were trying to figure out.